Constipation. This is not a serious problem. It's not a disease, but a discomfort, an uneasiness, a psychological disturbance. We start bothering only when something goes wrong and when something is disturbed in its rhythm. Same thing with passing motion. If you are not able to pass motion 2 or 3 days, that's a problem. If you pass 2 or 3 times a day, that is also a problem. So constipation, diarrhea, all these can happen in diabetes. Why I am talking about this topic? I had a patient some time ago. He used to take a tablet, Dalcolax. Of course, many of you know it's a laxative. He was taking 8 tablets per day. Before going to bed, he used to take 8 tablets. In spite of that 8 tablets, he was not able to pass motion the next day. What does that mean? The tablet is not working. This tablet does not treat the cause. That patient is a diabetic for a long time, a mismanaged diabetic person. Unless you treat the cause, you cannot treat constipation. Well, we are talking about diabetes and constipation, isn't it? This itself shows the cause for these people having constipation is because of diabetes, uncontrolled diabetes. So, what is the cause? Diabetes. Our question is, okay, sir, I have diabetes, I have constipation. I will bring back my sugar level to normal. Will it be okay? It's not possible because this complication is not a big complication like renal failure or heart attack or neuropathy. This problem because of mismanagement for the past 10 years. Do you think that it is possible to reverse this problem within a matter of 10 days, 15 days, or a month? When you have a loss of sensation in the foot, that means the nerve almost did. It stopped its function because of 10-year mismanagement. You think it's easy to bring back to this loss of sensation or burning sensation, etc.? Most of the drugs people prescribe to mask the effect of this nerve damage. They are not treating the nerve damage. Same thing with this constipation also. So, what you really mean by constipation? A person who has not passed this motion at least 3 days in a week for many weeks, then you call it constipation. Second, you are not able to completely evacuate the bowel, in the sense you feel incomplete evacuation, and I pass a very hard, small bits of motion, and for that I have to strain a lot. Here also I'm not satisfied. And because I have not passed motion as I wish, I feel bloated, the fullness of stomach. My appetite is not normal. I'm not able to eat as I used to do. These are all people who are not diabetic feeling this type of thing. They take it easy in the sense it can be reversed. But what happens in a person who is having diabetic and why he is having this constipation? What are the reasons, possible reasons? One is dehydration. People, they pass very frequent urine, loss of fluid, loss of water, loss of electrolytes, sodium, etc. Stool become hard. And second is change of diets often. We hear everybody talks about diet, everybody prescribes some diet, and this sort of changing pattern alters the rhythm of your stomach, and the stomach intestines, they feel every day I'm given a different types of dose. I don't know what to do, how to handle this and all. So change of diet very frequently. There is yet another problem with these people, what is called a gastroparesis. Gastro means something concerned with your stomach, intestines, etc. And the paresis means a partial loss of function. I can even say a partial paralysis. If there's a total paralysis, there is no movement at all. But here, a partial loss of function. The function of the stomach and the intestine is contractions, relaxations, forward movement. So, unless there is a complete contraction, the food will not move forward. It stays in different places for more than required time. If it stays more than the required time in large intestine, more of water is absorbed. The semi-solid motion becomes a solid and then a hard solid. So this stay of food in every part of the system for a particular duration of time is altered because of gastroparesis. And finally, you have what is called the neuropathy. You usually talk about peripheral neuropathy, the nerves in the periphery, your hands, your foot, your fingers, toes, they get affected and you will have the tingling sensation, the numbness sensation, the burning sensations, and finally loss of sensations. This you call peripheral neuropathy. But remember, inside also all the organs are controlled by nerves, their movements, digestions, secretions, enzymes, and the propulsion of food. Everything is controlled by nervous system, which is not under your control. So I can say it is autonomic nervous system, a system which has got its own power, regulates its own nerves and centers. You call it autonomic nervous system. They are not under our control. Voluntarily, we cannot do anything. They are all involuntary systems. When that is altered, the digestion starts steam from the mouth itself. You swallow. Swallowing alone is your act, voluntary act. Once it leaves the throat, it goes down into the food pipe, the esophagus. Alternate and repeated contraction relaxation pushes the food forward. The movement you call it a peristaltic movement goes to the stomach. In the stomach, it stays for 2 to 3 hours. The function of the stomach is to make them into a completely liquid state, then leaves the stomach into the small intestine. And if it leaves the stomach prematurely and the motility is more, and if it continues till the large intestine, then you will have diarrhea. So remember this movement from top to bottom, from the throat into the stomach, small intestine, into the large intestine, and getting out of our body as motion is controlled by a nerve. This belongs to the autonomic nervous system. This nerve controls every movement, the forward movement, the peristaltic contractions, everything is controlled. So the food, when it passes, stays in various parts of the gastrointestinal system till that function is fulfilled. The food will stay there. Then it will go to the next part. Like that, it goes up to the large intestine and gets collected there slowly. When it goes to the large intestine, it's almost a semi-solid with a lot of fluid and liquid there. Throughout the night, it stays there in the large intestine, and one of the main important function of large intestine is absorption of water. The water from this semi-solid feces is absorbed, and slowly a watery motion becomes a solid motion, and it goes down till the rectum and gets collected. The rectum is slowly getting filled and it gets stretched. When it cannot stretch further, immediately no impulses or messages from the rectum go either to the spinal cord. The spinal cord sends an impulse or message. Now you can start contracting. Without our control, this rectum, which is filled with, reached the maximum stretch. It causes a contraction of the muscles. Motion comes down, there is another sphincter, a valve like thing, which is under your control. You try to open that sphincter and increase your abdominal pressure, and you pass the motion. If you want to postpone for 1 hour, 2 hours, what you do is you contract the sphincter which is under your control, so you can postpone passing motion for 1 or 2 hours. So this is a normal mechanism by which food passes from your throat, converted itself into motion, and finally sent out as a waste product. If there is a misfiring of this particular nerve, or the sensations are not felt by the rectum, naturally the nerve which is taking this message will not get a message that I am overstretched and all. If this message does not reach the central center will not send a message to contract, to evacuate. So this reflex mechanism fails in diabetic people. So that means the large intestine does not feel it is completely filled and it is completely stretched. Even if it is stretched, it is not able to send the sensory impulse to the center because the nerve is not working properly. So naturally, you are not evacuating the rectum. You go for constipation. Because the nerve is damaged, they are not able to sense the stretching of. This may take 5 years, 6 years, 7 years, like that, because of mismanagement. Now tell me, is it possible to completely reverse this back to normal within a short time? Or at least it is possible. That itself is a question mark because there may be a permanent damage. If there's a renal failure, you can change the kidney, but you cannot change the nerve supply to the rectum. So now you know why diabetic people, apart from the rectifiable, reversible causes, why they get this much of constipation, all because of mismanagement. Whatever you do, you cannot go back to normalcy. That is why we always insist prevent the complications. Once it occurred, it's a one way. You cannot come back. When there is a partial damage to the vagus nerve which is supplying the rectum and all the parts of the gastrointestinal system, the nerve gets irritated unnecessarily. So it sends unnecessary impulses, misfiring of impulses that may cause increased motility. And instead of the food staying in various places for a particular time, it moves very fast and finally it comes out as loose motion diarrhea. Now you see, diarrhea is also common in diabetic because of nerve irritation, partial damage, and constipation is common because of total damage to the nerve and loss of sensation of the rectal muscles. That's why I told both are common in this diabetics. As far as the treatment is concerned, unless you treat the cause, the effect cannot be treated. You can't even give a symptomatic relief. That is why the person who took 8 tablets could not evacuate his rectum. So at least to prevent further damage, you can control the blood sugar and you can reach the target so that you can save other parts of the blood supply, blood supply, blood supply. If the blood supply is stopped in heart, you get attack, myocardial infarction or heart attack. If it is in the brain, you get stroke. If it is stopped with the kidney failure. And if it is foot and leg, you get loss of sensation and amputation. Like that. This is also a loss of blood supply to the nerves, and you get a constipation because of neurological damage to the nerves which are supplying the rectum. What is the solution? Very difficult. I think we will see in the next video. Till then, thank you. Bye.